Today, we're diving into something that seems so simple but is actually one of the highest stakes processes in all of medicine: how we label the tiny little blocks of tissue and glass slides that are at the very heart of making a diagnosis. It might not sound glamorous, but believe me, getting this right is an absolute patient safety must. So let me just ask this right up front. Can a tiny label, maybe an inch long, really be the one thing that stands between a correct diagnosis and a catastrophic, life-altering surgical mistake? The answer, unfortunately, is a resounding yes. For you as a trainee, and for every patient you'll ever have, the stakes just don't get any higher. And look, this isn't just some hypothetical risk I'm talking about. This quote comes straight from the official guidelines we're going to be looking at today. It really gets to the core truth of pathology. If you don't have a perfect, unbreakable chain of identity from that patient all the way to your microscope, the whole diagnostic process just falls apart. Okay, so what makes this whole process so vulnerable? To really get why the solution works, we first have to understand the problem. So let's take a look at the data that showed just how often these mistakes were happening and why it became so obvious that we needed a national standard. I want you to just picture the journey a single tissue sample takes. It goes from the surgeon to a runner, to the grossing bench, to a processor, then to a histotechnologist for embedding, then another one for cutting, and finally it gets to a pathologist. That's at least 6 handoffs, and every single one of those steps is a place where mix-up can happen. So, how often do things go wrong? Well, a major study by the College of American Pathologists, or CAP, put a number on it. They found an overall labeling error rate of 1.1 for every 1,000 cases. Now, that might sound small, but if you're in a busy lab that's churning through thousands of cases a week, those errors add up. And they add up fast, and every single one is a patient at risk. And when the researchers really dug into the data, the numbers got even more, concerning. The highest error rate they found, 1.7 per 1,000, was for tissue blocks. And that's a huge deal, because those blocks are the source material for every single slide we look at. It's the most critical link in the whole chain. You know, a rate like 1.7 per 1,000 can feel a little abstract. But this number, 8, this is about the human cost. One study that looked at the root causes of errors in the Veterans Health Administration found 8 cases where a mislabeled sample led to significant patient harm. We're talking unnecessary lung surgeries, prostatectomies, hysterectomies, 8 preventable disasters, all because of a simple labeling mistake. So with stats like these, it became painfully obvious that just having individual labs try their best wasn't going to cut it. The entire field needed a single, unified, evidence-based gold standard that every hospital, every lab, could follow to protect patients from these completely preventable harms. The problem really was just inconsistency. Every place had its own way of doing things, which, as you can imagine, led to tons of confusion and errors. So 2 big players, the College of American Pathologists and the National Society for Histotechnology, they teamed up. They pulled together a panel of experts to go over all the evidence and create the very first national guideline for how to label blocks and slides. All right, so these experts get together. What's the solution they land on? Well, they came up with 12 key recommendations, but honestly, they all boil down to just a few really fundamental principles that you absolutely have to know. Let's break them down. If you remember only one thing from this whole discussion, make it this: the 2 identifier rule. It's the bedrock of the entire guideline. Every single block and every single slide has to have at least 2 separate pieces of information that link it directly and without any ambiguity back to that patient. So why 2? What's the magic in that? Well, just take a look at this. On one side, you have a label with just an accession number, like S1499999. It's just a string of numbers, right? It's really easy to accidentally swap a digit or just misread it. But now, look at the other side. You add a second identifier, like the patient's name. All of a sudden, you've got a clear visual contrast between letters and numbers. It makes the label much more distinct and just massively cuts down the chance of a mix-up. So that first identifier is almost always the accession designation. But this isn't just some random string of characters. It's actually a code. It tells a story that tells you exactly where that tiny piece of tissue came from. Let's decode it. Okay, let's walk through this together. The S tells you it's from surgical pathology. 14 is the year, 2014. 9999, that's the unique number assigned to that patient's case. But we're not done. A means it's from the first specimen container, say the right breast biopsy. The next one tells you it's the very first tissue block made from that specimen. And that final one, that's the first slide cut from that block. Every single piece of this code means something, and understanding it is crucial. The guidelines also cover a few other really key points. First, that long accession number we just decoded, it has to be the biggest, most prominent, easiest to read thing on the label. Second, if there are any special stains or procedures, they need to be clearly written out. And finally, and this is a big one, if you get a consult case from another hospital, you add your own label, but you never cover up the original information. So, we've got the problem, we've got the solution. Now we get to the most important part. What does all this actually mean for you as a trainee tomorrow when you sit down at the microscope or you're handling a specimen in the lab? And here's the absolute key takeaway. These guidelines are not just some rule for the histotechs to follow. This is a patient safety checkpoint for you. As the person making the diagnosis, the person reviewing the case, you are literally the final line of defense against a labeling error. You have the power to catch that mistake before it causes any harm. Let's just boil this all down to 3 things you need to do every single time. First, verify. Every time you pick up a slide, make a conscious effort to look for and confirm those 2 patient identifiers. Second, understand. Know what that accession number means so you can mentally connect it back to the right patient, the right report. And most important of all, question. If anything looks off, a smudged label, a missing number, just stop. Don't move forward. Ask for clarification. Never, ever assume it's correct. So I'll leave you with this question. The next time you're in the lab and you pick up a glass slide, what is the very first thing you're going to look for? Your focus in that one small moment, that is a critical link in the chain of patient safety. Thanks for tuning in.